Kogo News Time, 6:42.
Cold and flu season will see millions of us sniffling their way through CVS in search of something to help us breathe. But a recent study finds the active ingredient in many nasal decongestants commonly taken for colds is no more effective than a placebo.
I don't believe it, but maybe there's proof. Dr. Russell Skinner is with us on the Kogo News Live line. Doc, we swear by Alka-Seltzer, but these researchers say save your money. Who's right?
Well, I tell patients if something works for you, there's no reason not to stop using it based on a study. So if you're taking Alka-Seltzer Plus and you get good symptom relief, then by all means continue to use it. But if you're buying a decongestant over the counter and within a few hours of taking it, you don't notice improvement, then that product is not working for you and there's no reason to continue to take it or continue to pay for it.
So does it mean it's not working for you? Do some over-the-counter medications work for some people and not others? Is that what they're saying?
Well, I think that's true. Just in practice, everyone is a little different. Their metabolism is a little different. How they respond to medicines is different. This particular study, looking at phenylephrine, the active decongestant in most over-the-counter cold medicines, did not show any clinical significance over taking a placebo. Now, that differs from the older products that used pseudoephedrine as the major decongestant, which did show significant clinical improvement with use of that product. And that is still available, but it's not available out there on the aisle. You do have to go, it's what's called behind the counter. You have to go up to the pharmacist. You don't need a prescription, but you do have to go up to the pharmacy counter, request it, show an ID, sign for it, and then it's available to you in limited quantities.
And that's a weird day, too, when you see somebody at the CVS who doesn't have their ID with them and they just want a box of pseudoephedrine for their allergies.
Right. So it can be obtained, but for most people, they kind of want to be able to grab some that's there on the aisle or, sitting there on the counter at the checkout. They go, oh, I'll grab some of that because I've got the sniffles. And they don't want to have to go all the way back to the pharmacy and wait in line and then sign something and so on. So it's a convenience factor. But if you find that your over-the-counters that you're getting there in the aisle are not giving you congestion relief, then the next step is to go to one of those behind-the-counter products or talk to your doctor about something by prescription.
So which common cold medications contain phenylephrine hydrochloride?
All of them. Anything that says decongestant that you're buying there in the aisle, the active decongestant is phenylephrine. All those preparations changed about 10 years ago from what used to be pseudoephedrine to phenylephrine. So if you're getting, without necessarily calling out a lot of names, Robitussin multisymptom or Dayquil, NyQuil, any of those things that say decongestant, if you'll read the active ingredients, they all are phenylephrine.
But if you do go behind the counter, there was not a study on those, and those are known to work better?
Yes. Yeah, there's not a new study on those. Obviously, there were studies done back in the day when pseudoephedrine was coming to market that showed clinical improvement and clinically significant improvement with pseudoephedrine. And those are still available. So you can go and say, I need Sudafed, and you can get Sudafed behind the counter.
Man, who thought it would be this complicated to treat a cold? Doc, what is your advice for people who do have a cold or a flu?
Number one is to realize that it's viral. There's not a cure for it. There's no way to eradicate it per se, but it will run its course in 5 to 7 days. So all our measures after that are supportive. You can use Tylenol or ibuprofen for body aches, staying hydrated, making sure you're drinking plenty of fluids, making sure you're eating, because a lot of times people have nausea and they just don't have much appetite, but it's important to continue to eat because your body needs that nutrition in order to fuel our immune system so we can fight off the virus.
All right, that is Dr. Russell Skinner joining us on the Kogo News Live line.